Cancer remains a major health concern in Kenya, but the good news is it is largely preventable. With early screening, vaccination and lifestyle adjustments, women can significantly reduce their risk. As we wrap up Cervical Cancer Awareness Month, let's hear more on this topic from Dr. Marion Diana, obstetrician gynecologist. Thank you so much for joining us in studio.
Thank you.
We're talking about trying to reduce the risk of getting cervical cancer. So in terms of lifestyle and the lifestyle changes that one would need to adopt, let's begin with the risks in terms of lifestyle and the changes that would really be critical towards protecting yourself or preventing yourself from this eventuality.
Thank you, Lillian. So when we talk about the risks, we talk about risks that allow the HPV for you to be exposed to it. And we're also talking about the risk that allows the HPV to persist and become an infection such that now it becomes a problem. So the risk to get HPV is basically sexual intercourse. So cervical cancer is a sexual related cancer, which means that sex is a big thing when it comes to cervical cancer. That is when you get exposed to HPV. But we do have lifestyle activities that would make you have this persisting in your body. One of these is cigarette smoking. And what cigarette smoking is that it really makes your body not fight. And if your immunity is compromised, then you are able to have this virus persisting and therefore changing to cause cervical cancer. Other things that would cause that is things around immunosuppression. So people with diabetes, and largely diabetes, other than being something you get as a genetic disease, you can also get it because of lifestyle. So we really encourage people to make sure that they work around preventing anything that will work against your immunity. So if your immunity is compromised, then the risk to have that virus persisting in your body is higher, as opposed when your immunity is good. So things around nutrition, very important to have good nutrition, very important to exercise, but over and above all, it's very important to make sure you get vaccinated.
Right. Before we get into more on this, Dr. during our previous conversation, a lot of the men were asking about the HPV and their exposure to it. You know, asking because this is somehow is largely centered around women, but the HPV, as we do know it, largely transmitted through unprotected sexual intercourse, and therefore the men were asking how they too can protect themselves from either getting this HPV virus or transmitting it altogether.
So basically, if we talk about preventing to get HPV, it's largely an impossible answer to give, mainly because from a particular age, naturally, as a human being, you're going to be sexually active. And as long as you're sexually active, then the risk for contacting HPV goes high. But one of the things we do encourage is things around avoiding having multiple sexual partners, because that is now how you pick the various serotypes of HPV. And so things around being faithful, things around using condoms, and such kind of things are the things we encourage. But basically, we cannot tell people not to have sex. We just tell them to have sex in a way that they can reduce the risk. But not necessarily stay away from the HPV.
So we've talked about vaccination previously and now going into the regular screening and all of that. Let's talk about the early signs and symptoms that should be a warning sign that perhaps something could be amiss.
So largely, cervical cancer, in the initial stages, it's asymptomatic. And what does that mean? That you could literally not know. No symptoms whatsoever. By the time you're having symptoms, then we are actually talking about an already existing lesion or cervical cancer itself, because cervical cancer starts from precancerous stages. So precancerous means then that we can't really know until we do the screening. But now the cancer itself will initially, and most people will come because of bleeding after coitus. So they'll say, I had some contact bleeding, I had this bleeding just after sex, and I don't know what's going on. Some will have an abnormal discharge, usually watery. And this discharge is something you've never experienced before, and you realize it's excessive and it's foul smelling sometimes. When it's really advanced, some women will have pelvic pain, and pelvic pain will come in terms of lower abdominal pains or lower backaches, or sometimes they'll even feel the pain around their thighs, and they will say, I have this very persistent lower backache, I don't know what's going on. More than that, it can now go forward for you to actually have obvious bleeding. So most women will come saying, I have this bleeding which is not usual, or I have this abnormal discharge, or I have this...
This is at the advanced stage.
Yes, or I have this pain. But in the real late stages, it can even come with other complications. So the complications is what really causes more problems, because the position of the cervix and a lesion growing there, it will go forward to your bladder, and it will cause you problems in terms of obstructing your ureters in a way that you are having backflow of urine to your kidney, something we call hydroureter or sometimes hydronephrosis. Yeah. And with that, you can have kidney failure, and you'll have to go through dialysis. So just that relationship of the cervix with your bladder and the urinary system, that brings that consequence. If you go to the rectum, the same thing, that can grow backwards towards the rectum. You can get fistulas, whereby now those areas are communicating, and you start having leakages of urine, leakages of stool. More than that, this cancer can go to your lungs. You can start coughing blood. It can be very difficult for you to breathe. Sometimes we need to give you oxygen. And when the disease starts to spread, it can go to your brain. You could go into a coma. It could go to your liver, and you can start having yellowness of your eyes or something we call jaundice. So therefore, the moment the disease starts to go to the surrounding organs, now you start having complications because the organs are now getting diseased.
Right. And Dr. you have previously stressed that all this is preventable, because this is a cancer that's 100% preventable, and that is also curable. So in terms of prevention, as we wrap up, let's talk about that, as well as, you know, in the unlikely or unfortunate situation where you find yourself having these debilitating effects of the advanced cervical cancer, how to manage them and the support resources that are available in this country.
So if we start quickly around prevention, we have very many options. Some could look like they are a bit affordable, some are quite costly, but the government is actually working to make some of these services available. So the one that is in the National Cancer Control Program is screening, where you do acetic acid. It is stained on your cervix. The provider looks. If it takes up that acetic acid, then you will be told that you have a lesion, and the lesion you can actually be tested and treated. There's something we call cryotherapy, where you go, they see there's a lesion, they freeze it. So they treat that, and you go home. Right. And then you can continue with your screening. Or you can go, and then they'll tell you, no, this one we can just do a loop excision, and we are good to go. So other than the acetic acid, they can also check using something we call Lugol's iodine. And they check and they see what is happening around here. Your cells will behave differently when they are stained with that, if they have already abnormal cells. Then the commonness that we keep on talking about is the pap smear, and the pap smear will come with a cost. If you remember our last conversation, we said it has to be sent to the pathologist. Yeah. It will come with cost. It will also have issues around accessibility. Then we have the HPV testing direct. You test that DNA. And the beautiful thing about science and its advances is that right now you can even do self-testing. This HPV kit can be availed to you, and you can be able to collect the sample. The instructions are very clear, and you take that sample back to the lab, and you get your results. Right. Now, the beautiful thing about the HPV DNA testing is that it's highly sensitive. And if it identifies these high-risk DNA serotypes, then your follow-up is different and it can quickly move on. And this HPV DNA, we can take another 5 years before we screen you again. So if we look at what is it we would like to see a scenario whereby women can have easy access to testing for HPV DNA.
Right.
Because for sure, if my HPV DNA is negative, I already know I don't have the exposure. But if it is positive, I will have to go ahead and check if I have abnormal cells and move that direction like that. So far, what we have what the national program is providing for accessibility, and we usually say that one test that you are able to access, please go for it.
Right.
Yes.
Many thanks for your time. Dr. Marion Diana is an obstetrician gynecologist. There is hope. There is, of course, treatment options available, but the thing is vaccination, vaccination, vaccination also remains one of the, you mentioned previously, vaccination remains an option even for women that are already sexually active.
Yes.
All right. Many thanks. We're taking a short break. We're back with more in just a bit.